Sykes, the Bottom Line Pharmacy Podcast. We've got a great show for you this week, but before we get into the show, if you find this episode valuable, please like, share, and subscribe so we can help more independent pharmacy owners. Also, visit us at pharmacyaccounting.com. If you're overpaying in tax, if you're prepping to start, buy, or sell a pharmacy, or just have a gut feeling that your financials aren't quite right, we have a suite of services for every need your pharmacy is facing. Go to pharmacyaccounting.com and we can help you. Okay, now on to the show.
We went to a cruise for Thanksgiving.
Nice.
That was nice. I thought I was going to get out of cooking, but then we just had to cook before we left. So
I saw you. I meant to text you back, Nicolette. You texted me happy birthday or something.
Oh, you share a birthday with Nicolette.
Yeah, but I went dark that week. I took off. And I was like, peace, I'm out.
yeah, now that you're
Well,
old.
you were hanging. He was hanging with celebrities down there at
Yeah, that's right. Yeah.
what's his name?
Mark Cuban.
Oh, you were hanging with a
Buster.
Buster Murdoch.
Yeah. Ran into him.
Stayed next door.
Yeah. So, anyway, happy belated birthday to you too.
Yeah, thank you.
Awesome.
Yeah.
Both of you guys,
We're old.
I'm not going to say what it is, but both of you guys shared the exact same birthday, right?
No, you're a year older.
She's a year
Yeah.
older, so she's a
Year
special
older.
birthday.
I'm a year and a day older, actually.
Year and a day.
Scotty had the special birthday this year.
What do you mean? Oh, the big 40.
The big 40.
Yeah.
Yep.
Yep.
Yeah, how's it
Ended up
going?
in the road at a party. So pretty good. Pretty good, I'd say. I brought it in. I went all out for my 40th this year.
It's a big
It's
deal.
awesome.
It is a big deal.
What's new, Nicolette?
What is new? Well, it's
So
New
I'll go
Year.
ahead and fire off what's new. What's up with these peptides? I'm getting compounders asking me, can I do peptides? Because they're getting hit from everywhere. It's the TB 500. It's the, oh my goodness. I can't even pronounce these things.
There's so many of them, and it's incredible. So all of our pharmacies are getting asked about peptides, and there's ones that are more conservative that have been, even GLP is the glucagon-like peptide. So it's just a short chain amino acid. So there's a lot of them, and they've been around forever. It's just a matter of, and actually, Big Pharma is trying to put pressure on the FDA to reclassify these peptides as biologics, which would add more restrictions because compounding pharmacies can't compound biologics. Like there's a whole thing to it and a whole lot of angles. But I was even just reading an article yesterday just about these peptide parties that are happening in Silicon Valley and all this, where people are trying to biohack their, longevity, wellness.
Is that what you're going to do at Atrium-X, a peptide party?
We're going to do a peptide rave.
Yeah.
No, it's a
great.
real thing. They're teaching people how to reconstitute and inject and mix, and they're coming and just mixing a bunch of stuff together. It's wild. It's completely unregulated. So we are not doing that at Atrium-X. just to
She's
clarify.
like, flavor.
Yeah, not doing that. But it's just a testament to, this is what people are hearing. This is what's happening on Reddit. This is what patients are coming in asking pharmacies about. So you're going to have some of those that are just risky patients that kind of don't care about vetting or quality, but that's not the majority. Most patients care very much what they're, ingesting or injecting into their body, where it comes from, the supply chain. And so, what's going on with peptides? A lot. There's a lot of chatter in the legal pharmacy sector. There's a lot of chatter that the BPC 157, the body protection compound, will get reclassified on the FDA, and pharmacies will be able to compound BPC legally. So that's exciting. We actually have some of the 503Bs that we work with in our Atrium24 GPO that already have the BPC in testing. They're already working on stability and sterility toxicity and all that stuff, dosing. So we already have all the dosing information from these 503Bs. So we've already created all of our data analytics and marketing materials and prescriber RX order forms, sell sheets, patient info sheets. We have it all ready to go.
Just waiting on the FDA to give the green light.
Yeah, but a lot of, because who knows what the FDA is going to do and when. But there's a lot of very reputable sources out there that think it's going to happen soon. Who knows? But that would be interesting.
That's what I was kind of picking up on too.
Yeah. I just went to. I've been trying to go to one or two new conferences per year. That might be outside of our industry or just something that I've always wanted to go to, but have been traveling so much for regular pharmacy fun stuff that I don't get to. But I went to a new one this past year in December. It was A4M, so the functional medicine. It was Longevity Fest.
Longevity, yep.
Yeah, and that was in Vegas. Huge conference. And it was interesting because pharmacy wasn't the primary focus of that conference. It was more for like providers and physicians and nurse practitioners and things like that, but also med spas. And it was so interesting because the trade show floor, it was enormous. I want to say it was even bigger than, your Cardinal, your McKesson, your Cencora. It was even bigger than that.
Wow.
Much bigger. But they had all these wild things. I took so many pictures of, red light therapies and like these weird little hexagons.
I got a client that went there and bought the red light thing.
Really?
Yeah.
Mm-hmm.
Cool.
He's got a little suite next door to his pharmacy.
Yeah.
He's putting the red light therapy in there.
Mm-hmm.
Talk about diversification.
Got an email about it today.
Yeah. It was wild. And even these, because some of it, you're like, is this like woo-woo? Is this real medicine? What is this? What's happening? Yeah, like these hyperbaric chambers and all these different things people were getting into. And then just as a pharmacist, I always wonder about the credentials. So like, is this like a regulated in any kind of way? Is this a medical device? Is this, and then how much do we trust the regulation process that things are going through? Just you start to really think. But number one, as long as it's not harmful to people, that's very important. But Longevity Fest was really cool because what I gathered is pharmacy used to not be a big part of it at all. But in, last year and especially this year, pharmacy was almost the focus. Now that compounding and peptides and all these things have come to the front. So there were a ton of booths there with compounding pharmacies. A lot of them were our clients, which was fun to see, and they use our .ecrm. And then the rest of them, I was just kind of talking to and asking because they're so big. They're licensed in so many different states. They have, a whole sales force with a dozen plus sales reps regionally all over the country, whatever it is. And so I just learned a lot about talking to these pharmacies. How did you scale? What's your focus? What are you looking forward to in 2026? So it was really, really enlightening from that aspect.
Yeah.
That's
very
a lot of
interesting.
pharmacies really take off. Compounders really take off in the multi-state stuff.
Yeah.
Yeah. That biohacking community is really big. It's it's very niche, but there's a lot of people in there are on the forefront of some of these medical therapies. So could be an interesting way for pharmacies out there to diversify their revenue, get into things like red light therapies and stuff like that, and market to people that are into the biohacking stuff. So that's
that
very
gets into the
interesting.
wellness area of Austin and just the shift in the demographics with people wanting to get into wellness instead of preventative stuff, instead of reacting to it, and the opportunities that's going to open the door for pharmacies.
Yeah. Nicolette, I wanted to ask you about telemedicine because I know last year at Atrium, that was a big focus of what was talked about there. What's new on like the telemedicine and virtual care side of things that, Atrium24 is kind of leaning into?
Yeah. Telemedicine is huge. If your pharmacy doesn't offer telemedicine and offer it in the most frictionless way possible, then you're already at a big disadvantage because your patients are already being marketed to by the big telemed companies online, your Ro, your InryMeds, your Hims. So we actually have 2 telemed solutions in the Atrium24 GPO. I use one of them in my own pharmacy, and especially now that it's New Year's, new year, new me, everybody's blowing us up about getting a GLP prescription or getting a peptide prescription. So it's nice. They just go straight to our website. They click on telemedicine. They can select which therapy they're interested in and answer a few qualifying questions. And then they get on with the assessment with the provider. The telemed's licensed in 50 states. So they already know, depending on what the requirement is for your state, whether it's synchronous visit with the prescriber or asynchronous, and what labs, what photos, what things have to be uploaded for telemed. But patients love it, and that's kind of the way that they're expecting care now going forward, especially for these cash pay, health, wellness, longevity, like patient-led therapies. Because if they go to their primary care or their PCP that's owned by the hospital group or something, they're probably not going to be allowed to write for these compounded therapies, or they're not going to be educated very much.
I was going to say a lot. I don't think even know about a lot of these things to be able to offer it.
Yeah, that's exactly right. And I don't mean it in a condescending way. I'm sure that all these prescribers know about the therapies, but just as far as like, well, how do I write for it? How does it come? Where could I get it from? Because it's not on the hospital system's formulary at all. And so it helps with that disconnect. So telemed's huge. And
what would be a reason why someone would not do telemed? I mean, just out of curiosity. I mean, what's the barrier there?
It used to be very, think about even during COVID, which wasn't that long ago, a few years back, 3-5 years back, you had telemedicine, and you had, if you remember, there was a company that was doing like ADD meds during COVID. And it just wasn't very mainstream. People didn't know, how does my state board feel about telemedicine in pharmacy? What are the requirements in my state? Am I going to make the other prescribers in my area mad that I'm pushing this, telemed doc or whatever it is? Am I going to cause friction with patients that are seeing them and also seeing telemed? And then I can think of one company in particular that got in a lot of trouble during COVID, after COVID, for prescribing, Ritalin and Adderall and controlled substances through telemedicine. So telemed was always in the past a little scary, a little
gray area.
and almost like, well, geez, layering one scary thing on top of the other. Like, now we're doing telemedicine, now we're doing controlled substances, and with telemedicine, the pharmacist has to ensure, with every prescription, the pharmacist has to ensure that there's a valid patient-prescriber relationship, that prescription was pursuant upon. So, if it came from the clinic down the street, you have a relationship with them, the patient went there and saw the provider and got a prescription and it got e-scribed to you, you feel pretty good about, that relationship. But if you don't know the telemed clinic and some prescription just shows up from out of state, in your e-scribe queue for a controlled substance, like that's back then when it got kind of scary.
Right. That makes sense.
Yeah. So I would say that's what I would think the apprehension would be to participate in telemedicine. But now, you're vetting the company, who the prescriber is, you're telling your patients to go see them, you're getting prescriptions from that prescriber regularly. Typically, they're not for controlled substances. You might see some for some testosterone. Right. But it's typically for a range of products. So
are you just signing up with this telemedicine company, or are you like, how do you implement it in your pharmacy?
Yep. The implementation piece is a little tough. Every pharmacy is different, right? I always say if you've seen one pharmacy, you've seen one pharmacy. So if it's a compounding pharmacy, they have all their own formularies.
Perfect. Yeah.
And all their
That's
own.
a hell of a right there.
Yeah. And so to set up the telemed, this is kind of the piece that we've carved out for Atrium24 and that we try to automate as much as possible with our Dottie technology, is that implementation piece. So like, hey, I want to do telemedicine. How the heck, what companies should I start vetting? What questions should I ask? What pricing is reasonable? How do I implement it? How do I train my team? How do I put it in my workflow? So we help with, and Telemed's a perfect example, we help with that whole implementation piece. So we do it in my own pharmacy, and then we create all the templates and all the data points and triggers that you need. Through our GPO, we negotiate with these companies to get group rates, because it's so much easier for me if I go to them and say, hey, I have one pharmacy, I want to test this out, and then I can tell my friends about it. They're like, yeah, okay, you're one pharmacy. But if I say, hey, we have 300 plus pharmacies that we want to build this system out for, and we want to have white glove service, we want to all be treated the same way, we'll help onboard everybody through our software, and then we want a deal. We want to make it make sense for you and for all of our pharmacies. And so we've been able to do that with a couple telemed companies. So to implement, yeah, you sign up. Any of our GPO partners, we have all the links that you can sign up through Dottie, and the links that you can order and everything through Dottie, the product catalogs, the discounts and everything. But you sign up with the telemed company for this specific example, and then we help our clients with the onboarding, because we've structured it the same way for everybody. So we have our VP of customer success, Michelle. She'll get on a Zoom with our pharmacies. Since Telemed, I don't like things to be too complicated. Telemed's one of the more complicated things that you can do, I'll admit. But she'll get on a screen share and just show the pharmacies how to set up their account, how to get ready to ingest patients. And then on the back end, on the telemedicine, you can select which therapies you want to show on your landing page. So if you're ordering from a certain 503B, then you're like, oh, I want patients to be able to go on my page and select tirzepatide or Samoralin, glutathione, NAD+. And then if you have your own compounds that your pharmacy makes, you can enter those in, or they have a lot of protocols already where you can just select those, and then those will show as like widgets on your landing page for your patients to just go to your website, click on telemedicine, and then click which therapy they're interested in and start those intake questions.
Perfect.
What are some other profit centers or profit ideas for 26, Nicolette? We talked about the telemedicine. What else is out there?
Yeah. So what we're seeing pharmacies with the most success with, there is still a place for GLPs. I know when they were on the shortage list, yeah, there's a couple things that are happening in the GLP space. And actually, we're going to have another legal webinar in a couple weeks. We're going to have a legal panel at Atrium24, March 5th through 7th in Orlando. But because it's ever evolving. But right now, the drugs are not on shortage. So your weight loss drugs, your semaglutide, your tirzepatide are not on the FDA shortage list. So your options are, if you're a 503A sterile compounding pharmacy, and or if you partner with one of them via central fill, which we also have in our GPO central fill option, 503A can compound a patient-specific prescription, and it either has to be not commercially available, so it's a combination of a GLP with other things, or different than the commercially available dose. But it's not just that. There has to be a medical reason why the patient can't take the commercially available dose. And that medical necessity has to be documented on the prescription by the prescriber. So
allergic to high dose or whatever,
Yeah, like maybe if they're combining tirzepatide with B6, I'm seeing a lot because that'll reduce nausea, because GI is the number one side effect. GI issues is the number one side effect for patients with GLPs. It's a hotly debated area because that flies, but then if you're filling thousands of patient-specific prescriptions, but it's the same exact thing with the same exact note for every patient, then you might have to go through the exercise of, does that meet the definition of patient-specific? There's even some articles that went out today. Scott Bruner at APC, he does a great job for advocacy and for just talking to the press and doing all those things. And his article today was just talking about, is the FDA's inaction opening up these gray markets? You know,
True.
we talked about
Could
these
be.
peptide rave parties and all this. And so we're all kind of waiting on the FDA. What's going to happen? But they also don't want to overstep. If the FDA comes in and says, we, the FDA, are now going to decide what is clinically significant, well, now I think they've overstepped, because the prescriber is supposed to determine what's clinically significant with that valid patient-prescriber relationship.
Yep.
So where is that line?
It's interesting.
Yeah.
And those weight loss
Some
drugs.
interesting times in the compounding world today.
Yeah.
Those weight loss drugs are still hot. I mean,
Oh
everybody.
my gosh,
That's all I hear.
they're everywhere.
Yep. Yeah. So there's those. Those are, they're
Plus,
not
there's more of
technically.
that coming, right? Different
Oh, yeah.
forms. Pill and,
Well,
this and
yeah,
that.
Samorlin, the TB 500, the
Yep.
BAP.
there's a lot.
These,
Just yesterday, I think the Wegovy oral tablet was approved, released, whatever it is, for
What about Nicolette?
weight
These
loss.
well, you got the oral tablet, but there's chatter of these Wegovy's and stuff going direct to consumer now, I
Yeah.
believe.
Mhm.
What do you think that's going to do?
It's interesting because we have this whole issue of PBMs and TrumpRx is trying to provide a solution. You have all this most favored nation stuff that everybody's trying to figure out, reimbursements. I know you guys are putting out a lot of content on that.
Yes.
And one of the solutions that we're seeing is potentially completely bypassing the entire pharmacy infrastructure in this country.
Right.
So obviously I don't see that as a viable solution, since that's
Right.
my livelihood, but
that makes no sense. Yeah.
no sense. But it's
Really, it's everywhere. And then it's like people can go now to Costco and grab their.
It's frustrating too, because let's think about you think about the medical marijuana. That completely bypassed pharmacy too.
That's true.
And they just opened up these dispensaries.
Dispensaries, yep.
Which, what is a synonym for dispensary? Like, it's fascinating to me. So now you have these little MMJ pop-up clinics, you have insomnia, come get your card, and then go to these dispensaries, and completely bypassed pharmacy there. And now you have these brand name drugs, and it's like, oh, they're too expensive, and PBMs are keeping too much money. What do? Bypass the entire pharmacy infrastructure.
Yeah, how far does that go with other drugs? And
Yeah, it doesn't make sense.
Yeah, I mean, my question is, where's the pharmacist in all of this? Like, shouldn't there be a pharmacist somewhere in here?
Right.
Pretty important.
You would think.
I don't know.
I agree. I mean,
because then you have something.
I mean, if you're on like 10 different drugs,
and
Right.
there's no pharmacist like monitoring any of that,
Right.
or you're just buying from here, this vendor.
Right.
What's going on here? I don't know.
That's true. And that's one of the first things that we were taught in pharmacy school, is how to manage polypharmacy. So you have patients who are getting prescriptions filled at all different places. There was a lot of chatter for a long time about health records and all these electronic health records. They were going to be available to pharmacies so that we could see, oh, they're getting all these heart meds filled with me, but then they're getting all these, I don't know, anti-rejection meds filled from their transplant pharmacy over here, their specialty pharmacy. And then they're getting all these filled, So there's definitely going to be patient-drug interactions, adverse reactions that nobody's going to catch because nobody's looking.
Well, it's also, I mean, I'm not a pharmacist, but isn't there some life and death, like, reactions that can occur with mixing certain stuff? So,
yeah.
I guess then it comes into pharmacist / then your provider also is supposed to be looking at what you're taking when they prescribe it.
I don't know.
It's supposed to be, but if we because if we think this through, if you're going to each brand manufacturer and their wholly owned telemedicine and their fulfillment channels, whatever that is, to get the prescriptions delivered to you, it's coming from all over the place. And then if you do have some on your health plan that they're mandating you use their mail order pharmacy,
it's all.
There's no.
I appreciate my independent pharmacy down the street that can see everything that I'm taking and
Yeah.
can pull me over to the side when I pick something up to give me a heads up on.
Yeah.
Well, you're
Because
not
I
waiting
like
for it in the mail either. I mean, if you got a sick kid, you go get it, you know?
Yeah, but they can look at what you're taking. All your drugs are there. They're looking at what you're taking, and they can notify you. Something's up. You know,
Yeah.
I appreciate that.
A lot
I
of
guess
times too. Yeah, well, a lot of times too, as a pharmacist, I know I don't really like medicine that much. So you don't want your patient to be on 12 different therapies. You don't, and then when they come to you and they, hey, I just got this new drug added on. Here's my updated drug list. Do I need to be on all these things?
Right.
And usually you try to figure, all right, yes, right now you need to be on all these things. But what's the plan to get you off of some of these? And then another question too, I'm on all these things. What nutrients are being depleted? So what supplements do I need to take?
Supplements.
So we're shifting to the wellness side again.
Then back to the wellness. Yeah.
Yeah.
It's pharmacies being wellness centers, really.
Yeah.
In addition, obviously, their expertise. But
yeah, so it's an interesting point. So we do still see, to answer your initial question about profitability and what we're seeing, because we ingest a ton of data every day and have a lot of analytics running against it. Our compounding pharmacies are doing really well. Even our non-sterile compounding pharmacies, even the ones who don't do any GLPs, they're doing really, really well. It's in a lot of my bigger pharmacies too, predicted this would happen with all this GLP craze and with all this online telemedicine and direct-to-consumer marketing, because you don't know which pharmacy they're using, and they're using 8 different pharmacies in their 503A sterile operations. But a lot of the regular, traditional, popular compounding therapies were going to be neglected.
Right.
And they were. And so a lot of prescribers are really open to hearing your pharmacy talk to them about hormone replacement therapy, compounding, LDN, the low dose naltrexone, methylene blue, just all this standard, traditional, bread and butter kind of compounding that patients still need and want very much. Veterinary compounding is huge. So
we need a whole podcast on hormone replacement.
Yeah, it changes people's lives. So it's always been one of the biggest compounding categories. But the whole underlying current that we see to everything is speed to market. So for these pharmacies, think about July, it was like June, July 2023. That sounds so far away now that we're in 2026. But that was when the very first black and white print, which pharmacies love, has to be in black and white print. We don't like being abstract. But that's when it very first came out in print that a 503A pharmacy could buy from a 503B FDA registered outsourcing facility. And there were so many pharmacies, so many buying groups, just conservative, traditional buying groups, generic drug houses, just very much like traditional pharmacy operations, and even the companies that served them that were like, no. You can't do it. We're not getting involved. We don't recommend our pharmacies do it. Nicolette, you can't come exhibit at our conference and talk about any of that because we don't think it's okay. Now, if you're not buying from 503Bs into your pharmacy, you're leaving a very compliant, profitable, just business line that your patients would greatly benefit from. You're leaving it out of your business.
Yep.
And I don't know why. So state boards, a lot of them either were unsure, were unwilling to comment on it, or a couple were just outspoken against 503Bs. Now, most state boards have come around. There's a couple that still always seem to have some issues with pharmacies. But what's interesting to see is when you think of speed to market, 503Bs, how many pharmacies waited and didn't start ordering from 503Bs, didn't dispense GLPs when they were on the shortage list. Maybe they waited until like the last 2 months before it went off shortage. Well, how much bigger could their business have been, and how many more patients could they have
I
served?
had a lot of clients say, "Man, I wish I would have gotten in this earlier."
For
And
sure.
I say it cautiously because I'm not trying to be aggressive. I'm not trying to push into risk. I know that we have a lot to lose on the pharmacy side, so we have to be much more conservative and compliant than those peptide parties in Silicon Valley. Sure. But there's so much opportunity. So think about before the GLPs, it was COVID, right? So you had all the COVID testing and you had all the COVID vaccines.
Yep.
So how many pharmacies, oh, I'm busy, I'm not gonna test people, or my county's testing people, I'm not gonna test people, or just different reasons or excuses why you don't get started.
Mhm.
So I think what everybody needs to focus on now, because you're absolutely right, Bonnie, there's a ton more in the pipeline.
Yeah.
Even on the GLP side, and especially on the peptide side. BPC, I think, is coming very soon, I hope. Retatrutide is another GLP that's really big in the gray market. But Chinese peptide companies, research grade only, not for human use, being used a ton in this country for humans. Completely
Peptide
outside of completely outside of the
And we got the BPC for the party.
completely
What?
outside of
Humans yet, but let's give it a shot.
people do. It's I think it's scary because
Yeah.
well, even this article I was reading, people are ordering peptides, just powdered peptides
Mhm.
in vials, from China. And then some of them are getting it tested in some European countries. They're paying to get it tested. But it's like, well, there's no regulatory system. And it's
Right.
not this country. This country is not regulating these things. So is it good? Maybe. Is it, adulterated?
I want to be the test
Probably.
rat.
No.
Yeah. But all to say, when that retatrutide does finish its trials and become FDA approved, is it going to rocket through and get on the shortage list? If it is, let's say it got on the shortage list tomorrow, would your pharmacy be ready? Do you know how your state board feels on 503Bs? Do you know which of the 95 or so FDA registered outsourcing facilities, 503Bs in this country, do you know which ones have a product catalog that cater to pharmacies? Are you up on any of their inspections or like how that market's going? Do you have the structure in place to talk to your prescribers about these therapies, to talk to your patients, to get those prescriptions written and sent in? Because it's big business.
Yeah.
This is what patients want. This is what's all over the commercials on TV now.
Mhm.
So I think it's really important for our pharmacies to be ready for what's coming.
Opportunities are there and are coming for sure.
Absolutely.
Like you mentioned, everyone should be able to learn from the last time that these things can pop up, and so you need to be prepared for it so that you can get in the game.
Yep. And we might not even know
Nicolette, tell
what it
us
is.
about before we let you go. Tell us about the Atrium X show.
Yeah, that's exactly it. Yeah.
Yeah. So it is coming up. Atrium X, March 5th through 7th in Orlando. We're going to be at the Rosen Plaza. And if you guys remember from the PDS days when the conferences were always in Orlando, Rosen Plaza is right near the convention center, not too far from the airport. I really love that area. It's a great hotel. I was even just there the other day. There's that Point Orlando right across the street, tons of stuff to walk to. So that's always important for me. Like, where are we going? So I'm not just inside of a ballroom. But March 5th through 7th, the roster's looking really good. So it's completely different type of conference. I don't have an agenda built out.
An unconference. It's an
yeah,
unconference.
it is. It's an unconference because what we're doing is we're bringing folks in, and in real time, we're going to build the agenda together.
Yeah,
So the first night, Thursday night, everybody gets there. And you guys know you were there on the very first year that we did it, 2025, and you guys are going to be back. Sykes
We
is
sure are.
exhibiting. Yeah, so we appreciate you guys being there. And everybody comes in on Thursday. We do kind of some fun icebreaker activities. And I'm not much of an extrovert. So if I'm willing to do this, like, you guys are all fine. You can come in and you can do this and you'll enjoy it. But everybody gets to know who's in the room, who's doing what in their pharmacy, who do I want to talk to over the next couple days. And then we vote that night on what do you want the breakout topics to be about, who's putting their name in the hat to be a subject matter expert. We do have professional facilitators. We have Kelly Babcock back this year, Terry Norvell back, and we have some expert facilitators that they know how to kind of keep order in the room. They know how to keep us on topic and how to pull information out of the folks that normally wouldn't share in a public setting. And that's my favorite part, because we go to all these trade shows and it's a lot of the same talking heads on the stage. And we had to prepare a slideshow 3 months in advance. We had to submit it to some college of pharmacy so they could tear it apart and tell me, us, whoever, all the things.
And there's new topics that's come up since then, and we're talking about something.
It changes, the content changes, and it gets all watered down. This is a CE. You have to remove all these dollars. You have to remove all these company names. You have to remove all these specific details. And I'm like, well, that's frustrating. So we cut through all that in real time. Everybody votes on, what do you want to talk about now? Like, what's happening in pharmacy right now? Who has experience in this? Who can be a subject matter expert? And then that Thursday night is when we make the schedule for the 8 breakout sessions that we're going to have on Friday. And so we have those breakout sessions, the expert facilitators. We have different structures. So one of them is the very first few minutes that you come into the 1 hour breakout session, everybody write your questions down on Post-it notes. And then you put the Post-it notes onto a board, and the facilitator will get things started while the subject matter expert kind of looks at them. And then you just jump into the conversation.
No, it's really good. It's like a boardroom,
awesome.
And then you've got like, all the pharmacy owners.
There's a lot of, it's almost like a mastermind. There's a lot of innovators at that conference, a lot of them.
Yeah. Yep.
There's a lot of good things about it last year, Nicolette. So that's awesome.
Yeah. And that's my goal, is to pull in as many folks from as many walks of pharmacy as possible, so that we get all different viewpoints. And you pull in some really successful folks. You pull in some really deep thinkers. You pull in some folks that, that I've seen in their data sets, like, you're doing something really fascinating. Now, without sharing all, your trade secrets and things, can you come in and talk about, how you work with drug manufacturer rebate programs was one of the ones last year, or how you're doing your cash program in your pharmacy. But it can even be basic things like, how do you handle your employee evaluations and your bonus structures and just all the stuff that we have to do on a day-to-day basis? But it's nice to be able to bounce it off of other people dealing with those same variables every day too.
Exciting.
Yeah, absolutely.
Yeah.
No, it's a great conference. We're looking forward to it.
If you've seen one pharmacy, you've seen them all.
Yeah, they're all the same.
And I imagine, of course, they're going to vote on it, but I imagine a lot of the things that we talked about today are going to be talked about. I mean, telemedicine was talked about last year. That's probably going to be on the docket again.
Yeah.
AI, stuff like that. I mean, it's a really innovative conference. It's I like that one a lot.
Yeah. New for this year, we do have a panel on AI, and I'm trying to get as many AI companies as possible at the conference. So we do have several in the lineup already, and several AI founders who are going to be on the panel, and also pharmacies that work very deeply in AI are going to be on the panel. So we'll talk about that. I'm sure that one of the breakout sessions is going to be about AI as well. And then we have a field trip this year at AtriumX.
Are we going to Disney?
No, even better. We're going to
a pharmacy.
Kind of. We're going to we're going to a 503B facility.
Oh, that's cool.
Yeah.
That is cool.
So I get to, in my work, I get to go as heading up the GPO. I get to focus on the vetting of these facilities. So I look at all their product catalog, their FDA history. I get to read, I sign an NDA, and I get to read a lot of like their correspondence with the FDA back and forth. And I get to hear about their plans. And then I get to go visit their facility and get a tour and see the entire production and ask a bunch of questions. And it's so fascinating. So this year, the Rosen Plaza is just a couple miles away from Olympia Pharmaceuticals. They just opened a brand new state-of-the-art 503B facility called Wesley Pharmaceuticals. So it's a sister company to theirs. And we just toured it recently ourselves. And March 6th, the Friday evening, we're going to have a private bus charter the registered folks. We can have about 50 people on the tour. So it's first come, first serve, whoever gets registered for Atrium-X and then signs up for the included tour. But Friday evening, we're going to Wesley Pharmaceuticals. We're having an entire tour of the facility and getting to talk with all them.
That's very nice.
Yeah, I'm excited about that. And
yeah, that's cool.
They're a really great group, the Olympia crew. They're in our GPO. Our pharmacies experience significant discounts off list price with those. So even if, your prescribers can buy from Olympia too. But if a pharmacy comes in on the GPO, you get such a deep discount that you can still sell those products to your prescribers, patient specific, and still come in better economically than if your prescriber would have gone straight to Olympia. So that's important too. But they're just top-notch operators over there. Really great, clean FDA history. They really know what they're doing very well. Great portal to work with, great products. We have a lot of our pharmacy clients that use Olympia every day and really like them. We do at my own pharmacy too. So not to be a huge plug about Olympia, but it's nice when when you work with partners where you're like, man, they do a really good job. It's good to support them. And so that field trip's going to be a lot of fun. That's on Friday night. And then Saturday at Atrium-X, we do something unique as well. Because how many conferences do you go to where you go and you listen to these presentations? They might be stale. They might be watered down. They might be wonderful. I'm not trying to dog anybody at all. But you go to the presentations, you're hearing all these things, but you don't have a chance to interact. You're taking all these notes, but then you don't have time to process it or talk with anyone about it and actually see like, well, what's my plan to implement this in my business and how does this make sense? So that's something we do at Atrium-X as well, is on Saturday morning, we do a deep dive with our facilitators, Kelly and Terry from the Leadership Growth Formula, where they talk you through implementing it into your pharmacy. We break into very small groups of like 4 people. And then we have timed activities and exercises where you're talking with these few other folks that run big pharmacy operations all over the country, all different kinds, about what you're taking back to your store and how you're going to implement it. And what was really nice to see this past year is the folks made such deep connections with each other throughout these little small groups over the few days that they still talk on text threads and on emails, because I'm on some of them, and they'll still, just as questions arise, reach out to each other. Yeah. And so then we do a plus delta.
It's like having an accountability. It's like having an accountability partner. Like you're like, hey, I'm going to have this implementation plan, and I'm going to work with another owner there to hold me accountable to implementing these things. That's really cool.
Yeah.
They're in the meeting room.
Oh, Copperhead.
Copperhead. I said rattlesnake. We try to do that when we go to. We try to get together. It's important. We go to accounting conferences as well, and you have all these ideas. Just when you said the notes, like I always take this thing in notes. I love to actually write notes sometimes.
Yeah,
it's like big key points, and come back fall that you're excited and you have all these ideas, and then it's like. But we go to the same place every year.
You got to network. I mean, the takeaway here, you got to network, and man,
and implement a plan. Put a plan in place to implement.
Atrium-X is a good opportunity to really network, not just go to a trade show and walk the floor, like actually network and together.
You got to somebody somewhere.
Yeah, I love it because I don't know if it's that I'm getting older or that I've been to so many different shows, but do not make me walk into the bar at the end of a long day. I'm old, tired, and then now I got to just try to, like, by chance, drum up conversations with folks.
Right.
If I'm going to talk about just nonsensical things because I'm tired at the end of the day.
You've spoken. You stood at a booth all day on a cement floor.
Yes, I know.
Now you got to hit the bar.
And everybody at the bar doesn't want to talk about anything that's related to.
No.
Bar time.
So what's nice is now you have these curated encounters at your peak brain time with other folks that not only want to talk about the same things that you do, so you can cut through any kind of small talk. So you just come in this room like, this is what we're going to talk about.
Yeah.
But they want to talk about those things too. We have these defined parameters we're going to talk about. So my type A mind is very much like that.
Yeah.
Yeah. I'll still talk to you in passing, but it's nice to be able to get some actual deep thought done with other people in real time who also want to do that. It is a wild time right now, though. So I definitely read all the content that you guys put out because it's so valuable. Things are and they're always like this, though. They're always just ever changing.
It's one thing after the next.
It is. Well, it just has been for years.
Yeah. Well, I'm just glad that somebody other than myself is reading our content.
Yep.
I was about to say, you read it.
Yeah.
I talked with a client this morning that was kind of shocked by their MFP stuff. I didn't know it was going to be like this, and I was a little disheartened because I'm like, we've emailed you, we've sent out blasts, we've done podcasts. I always like to hear you paying attention to it.
Yeah.
That's the beauty of what I'm able to do now that I'm really thankful for is that since I'm not behind the pharmacy bench, I sold my big pharmacy. It was just over 2 years ago now. So since I'm not behind the bench all the time, I have time now to read all these things that are coming out, to like do really deep dive rabbit holes into the FDA inspections, see what's going on. Like, and I'm almost turning into a little bit of a conspiracy theorist in some ways because I'm reading so much. But you hear what Big Pharma's saying, and Big Pharma's like, oh, these drugs are not on shortage, or, this is what's happening, or we're going to go direct to consumer. But then if you read the actual FDA inspection reports that are happening now, the FDA is inspecting 503B facilities that are making tirzepatide with additives or tirzepatide in non-commercially available doses.
And they're not writing
they're not writing anything up about it. There's nothing inherently wrong so that the FDA would shut them down, or so it's this inaction that's just so interesting right now. So I'm reading everything that I can to see what's happening and what's going to happen. But that's fascinating, I think. But it is
very much so.
You
could get an AI agent, Nicolette, to build you a summary of all the new inspection reports every day or every week or whatever, and give you
They have those. They have like social listening, where you can plug in these keywords. Yep. It's just fascinating. It really is. And so it's nice to have folks like you guys that, because I always say it's not rocket science. Pharmacies could do all these things. They don't have time.
Right.
They don't have time.
We're so many hats.
Yeah. Especially now in the new year, billing all these claims, dealing with all these insurance changes.
Yuck.
It's tough.
Yeah, it is. It's wild.
Well, thank you, Nicolette, for hopping on, and I reckon we'll see you in a couple weeks.
Absolutely. And if anyone wants to learn more about Nicolette and Atrium in the description of this episode will be her information. So the Atrium conference, her social media, all that stuff will be down there. Click away, have fun, and